20,000 breast cancer cases. Then it is followed by cervical cancer, which doesn't appear at the global level because it's a preventable disease, but we are still battling with it. And it's number 2. For every 100,000, we have about 39 people with cervical cancer. Then prostate cancer, followed by cancer of the ovary, and then that of the liver. So these are the overall 5-year prevalence, that's total burden. When we look at the new cases, again in the estimates we had 24,000 new cancer cases as per the 2020 report. And for our childhood cancers, on the average, we are having about 400 new cases annually, now especially the females. And it is no less harmful than cigarette smoking. In fact, in a shisha session, which usually lasts for 20 to 80 minutes, a shisha smoker can inhale the same amount of smoke as a cigarette smoker consuming 100 sticks of cigarettes. Yes, you heard me right, 100 sticks. So in case you were thinking shisha is a safe option, passing it through water doesn't make it any less harmful. God in his wisdom put certain things together. So when you go for weddings, you'll be told what God has put together, let no man put asunder. The reverse is also true. What God has put asunder, let no man put together. The good Lord in his wisdom puts the mouth and the anus mouth apart. And the mouth and the genitals mouth apart. But if we choose to bring them together through whatever orientation, then we should be ready for the consequences.
President, who are dying from cancers or who are getting cancers, who are not being captured within the formal system. And so the numbers are more than that. And this is a disease that when you get, your chance of survival is even very low. And so there is no question about the fact that we are having an epidemic, and clearly we need to do something about it.
We are not paying realistic premiums, and therefore the health insurance is not paying realistic tariffs.
We have a generous benefit package, which we take care of 95% of all disease states. And so we are doing a lot, and for those who want extra services, which are not included in our package, would have to enroll onto the 14 private health insurance schemes that we have in the country. And so since this is a policy issue, would have to handle it at the ministerial level if there are supposed to be any changes in any packages that we bring on board. And I think it will be welcomed if we are able to sit down and decide on what is best for our clients.
The greatest source of strength for me is the support that I received. Unfortunately, in our environment in Ghana, because of stigma, because of lack of financial resources, because of lack of facilities, people don't feel supported, people are not supported, and it unfortunately pushes people out of the medical system, which is the best place to be when you're diagnosed with not just breast, any form of cancer. So I would say that the support that I received was the key to my